1 in 8 women will develop a thyroid problem in their lifetime. Dr. Greg Silverman joins us right now with more on thyroid disease. There's several types. We've talked about this before. I thought it was interesting about the women, that 1 in 8. It's similar to breast cancer.
There's a lot, and most of it is hypothyroidism, basically where your thyroid just kind of slows down. It doesn't quite produce enough thyroid hormone. And so remember what the thyroid hormone does, which is it increases or regulates your metabolism. In addition to the thyroid gland, at that spot, there is also the parathyroid gland. There are 4 little dots that are on the back side of your thyroid gland, and they regulate the calcium in your system. And so that's important as well. So it's kind of important that you understand what the thyroid is, where it is. It's basically right here underneath your voice box. If it gets bigger or if you notice any lumps in it, and to talk to your physician about that.
You talked about hypo. There's also
hyperthyroid.
And they both affect weight and in some cases the bulging of the eyes.
Correct. If you get too much, correct. If you have too much thyroid, you can have your metabolism revs up. That is, your heart rate can go up. You can have irregular heartbeats. Blood pressures can go up. You feel sweaty all the time. You always feel hot. You can lose weight on those things, lose hair. It's important that you understand those.
Both my parents suffer from different forms of thyroidism, and I have a feeling I'm destined for it, so no genetics play a role. They continue to take medication to this day, and it's something once you have, because I have a few friends whose wives actually have it, and it's very manageable.
Sure, absolutely. I mean, with 1 pill a day, there's a lot of people out there that just take Synthroid or one of the generic types of thyroid gland replacements, and you can regulate it. All you have to do is get a blood test about every several months to make sure that you're regulated adequately and that your levels are normal.
In some cases, surgery is needed. Correct.
It depends on whether or not you have what's called a goiter, or whether or not you have thyroid tumors, or whether or not you have these calcific infiltrations of the thyroid, and your physician can talk to you about that as well.
It's a very important gland, and as you mentioned, it's right here under the neck. It's like a butterfly pattern.
Correct. It sort of wraps around your trachea, which is the windpipe. It's underneath the Adam's apple. So if you notice any lumps or anything else, talk to somebody about that.
Perfect insight, Dr. Silverman. Thank you, sir.
Thanks
Always a pleasure. Okay.